Hello and welcome to Strong at Home. I'm Dr. Brenda Murphy and I'm an educational psychologist with Sail Away Learning and Academy. We are talking today with Dr. Erin Plyler. Welcome, Dr. Plyler. How are you today? Thank you for joining us. Dr. Plyler is an audiologist, and we have been doing and are doing a series on this very important topic of hearing and listening and how that affects our children as well as us in their development, in their academics, and in their daily life. And on our last session, Dr. Plyler told us that there are actually two types of hearing loss. And so I want us to get into that so that you can understand what you or your children may be facing. So, Dr. Plyler, thank you so much for being here with us again.
I'm glad to be here.
Is this a confusing thing for a lot of people that we are just not aware that it's not just hearing? We think, okay, we have 20/20 hearing and we can hear really well, but maybe that's not always the case, is it?
Absolutely. You can have normal hearing, but your brain does not process or does not make sense of what your ear is hearing.
Oh,
and so that's where the breakdown occurs.
That's where, however, there can be other causes for not hearing. So I'm your student. Teach me about hearing loss.
Okay.
If we can have that, we'll put up a graphic here of the types of hearing loss. Give us just a second and we'll get that up.
Okay. There are two types of hearing loss. And the first type is what people are probably more used to hearing. Their grandfather doesn't hear as well and might need a hearing aid. This is our peripheral hearing. And it starts, if you look at that picture where the ear is, your ear canal and all those little bones within the ear is what's considered peripheral hearing loss.
Okay, because it's on the periphery of our faces. So periphery, that's a good word for all of you who are trying to build vocabulary. Put that on your word wall. Periphery is a great word. So explain some of the things that can happen in that peripheral hearing. What are things that are going on with that?
Typically, when you have a peripheral hearing loss, you either have it from birth, something wasn't formed correctly at birth within that organ of hearing, or as we get older and we have kind of noise exposure, if we've shot guns, we've damaged that organ of hearing somehow. And so a peripheral hearing loss is a damage to the system that really cannot be fixed without hearing aids.
Okay. Now, let me just ask you this. Are there also some issues with hearing that may not be able to be fixed with hearing aids?
And so that's where we would get into our central hearing.
Oh, okay.
And so if you have a peripheral hearing loss that, on the periphery, like you were speaking of, it's that organ of hearing that has that damage.
Right.
And the hearing aid is what's going to be the treatment for a peripheral hearing loss.
Ah, okay. So there is something that can be done for some of those.
Correct.
Okay.
Correct. Then we move into what's called central hearing. And where that little kind of Pac-Man orange sign is, that's where central hearing begins. And it happens within that brown kind of arrows and straight lines.
Yeah.
Those are your central auditory pathways that actually are responsible for taking the sound that the ear hears and processing it up the brain to the cortex. So
where's the cortex for those of you? Okay, right there on the top.
Right here on the top, where those two arrows are, that's the cortex.
Okay, and sort of around here. Okay.
Now, when the information comes in that peripheral ear, it has no meaning yet. It has to be transferred up those pathways to the cortex before it actually has meaning.
Oh, okay. So if something is interfering with that sound for example, with kids we talked that had ear infections, would have been some damage to peripheral, correct? Am I correct in that?
Correct.
Okay.
Correct.
So
when you have an ear infection, it is affecting that peripheral hearing, and it also is affecting what's being processed. So when you have an ear infection, it's kind of affecting both areas of hearing.
Oh, yeah. Yes, that's pretty revolutionary to think about for our children, because we think about as parents that we often our children have ear infection. That's a very common thing with most children. Out of my 5 sons, all of them had ear infections. I take it back, one only had one, but all of the others had ear infections. So that is really can be very impactful on their ability to hear.
And a lot of times those ear infections are occurring at those critical periods when they're trying to learn speech and language.
About how old would they be when they're starting to learn speech and language?
You know, they start babbling very early on, 6 months, they'll start babbling. And by 2 years, we're expecting 50 to 200 words from a child. But if they haven't had that good auditory experience because of fluid in their ear, they may not have those number of words. They just haven't heard them. So obviously they can't produce them.
Right. Okay, continue on. This is really interesting.
Okay, so if you want to go to the next slide. Yep. Okay, so as we said, the term processing will start where peripheral hearing ends, and it goes up through those pathways, and it transfers that signal up the brain. When it reaches the cortex, that's when meaning actually is assigned to that sound. If that signal goes in the periphery and up the central pathways intact, auditory processing is normal.
Okay.
If that signal comes in and either there's a peripheral hearing loss, it's not going to be transferred up normally because it wasn't normal coming in, or it is normal coming in, but there's something going on in those pathways that break down that signal. So that signal does not reach the cortex intact. That is an auditory processing disorder.
What are some of the things that happen in that process between accurate and normal or typical peripheral hearing and getting to the cortex? What are some things that can happen that cause that breakdown?
The majority of time, the reason that we have these breakdowns are really delays in the maturation of that central auditory nervous system. And so if you have a delay in those pathways, then you are not going to receive those messages at the same time as your peers might. And so you're going to be delayed in those, if that makes sense.
Yeah, well, I'm thinking in terms of an analogy to a seed that grows into a plant, that maybe all the seeds are there for the possibility of growth, but for some individuals, they're in that pathway between the peripheral hearing and the cortex. It's like those seeds haven't started growing yet, or they're very slow to grow. Is that
Absolutely? Another way that I will talk about it is it's almost as if you're driving on a gravel road and you're trying to get across, how insufficient it is to be on that road. But if you were on a highway, how easy it would be to drive over a nicely paved road. And that's kind of the difference between when a child's listening on a gravelly road, it's not happening very well, versus when a child is listening on a nice, clear pathway, it's much easier.
Of course it would be. Of course it would be. So if they're on that gravelly road, are there many different things that are happening along that gravelly road? Or is it just one it's just one type of gravelly road. It just has one kind of road that the children, that their sound are going on for parents to understand? Or could it be a lot of different?
It can be a lot of different because of that gravel road. Some children will experience different things. And so we really do the evaluation to pinpoint what is that child's experience because of that gravel road, which may be very different from another child's experiences, which is also why you can't have, treatment, just global treatment for everybody. It has to be very specific to a child and their areas.
Yeah. So what would be some of the things that you might, I know we need assessments. We'll talk about that later, but what are some of the things that are happening that you're going to be looking for that could be pieces of gravel along that road? What are some of the things that might look like for a child?
So they might mishear what's being said. When you tell them something, if you said, pick up your shirt, they might not hear the whole word shirt. They hear little pieces of it.
Oh, okay.
And so they're trying to fill in all day long what they've missed as they're going.
So what could be some consequences? I mean, I think in terms, if they're not hearing maybe another, as opposed to shirt, maybe they're actually hearing skirt. I mean,
absolutely.
And that creates a whole different brain experience or thinking experience. So with that child, they may, if they hear what they think might be shirt, they may get an image of skirt. I mean, this can be very confusing, can't it?
It can be absolutely confusing as far as those messages of what they're thinking was being said, or if a child is trying to take notes and they go back and read their notes and it doesn't make any sense and they're trying to study for a test or a spelling test, their notes don't really make a whole lot of sense if you were to read it, because that's how they're hearing.
Right. So this is how does what we're talking about is that maybe the words that they think they hear comes out as a different kind of word. So not only is it a problem of misinterpreting what you hear, it's also saying something that you think means one thing because that's the way you've heard it, but it means something. Is that part of this whole issue?
Yes, absolutely. That's exactly what's happening. And then if there's a little bit of noise going on in the background, what they hear, they mishear even more words.
Oh, goodness. So that if a child is, say, in a classroom with 20 or more other children, the child next to them may have a little ADD and constantly be tapping their pencil on the table. And would that complicate?
Absolutely. It's going to be just that background noise enough that it's going to be distracting them, and they're going to miss out on some of those messages that the teacher is sending or the other students are sending. A lot of times what happens is these students realize that they're not hearing or understanding what everybody is doing, and so they will do a wait and see approach. The teacher or the parent will say to go do something, and they will wait and see what everybody else does and then follows along with them.
Oh, that's very revealing. So that those children really, it makes them more dependent on others long term, so they can't develop independent living skills.
Correct. And so some of the parents will say they're not really go-getters. They just kind of wait.
Yeah.
Until other kids do something. They're a follower, or really they're not hearing correctly, processing correctly. And so they just wait and see what everybody else does and follows the pack.
So there are many different elements in the auditory processing, central auditory processing, that really is contributing to a lot of delays and even failures for children like this. So if that's the case, is there a designation that these children that you can give? You hate to say give, but is there some designation that is recognizable so that teachers and parents can help these children and others negotiate through life in a more productive way?
And so these are the children that we would diagnose with an auditory processing disorder. And the basic definition of that would be really when the brain can't hear.
Oh, that's a compelling idea. And you know what? We are out of time for this segment. Would you tell us more about that's intriguing that the brain can't hear? I mean, it's our ears that hear. So let's talk about this on another session because this is an important point. And so we'll end as we always do here on Strong at Home. That the Lord bless you and keep you. The Lord make his face shine upon you and be gracious to you. The Lord lift up his countenance upon you and give you peace. Peace to you, Erin and Dr. Plyler, and to all of you out there. And we'll see you next time on Strong at Home. Bye-bye.
Bye.